Hi, Colin.
Hi Keith, can you hear me okay?
Yes, can see you and hear you fine. So that's us live now.
Okay, so thank you members, and we do have a quorum and I'll call the meeting to order. I'd like to welcome all of our members who are participating by video conferencing this afternoon, and can I remind members about the protocols regarding the use of electronic devices. So checking for apologies then. Clerk, do you have apologies?
Yes, Chair, just to say that Paul has let me know that she may not be able to make it today as she's in the chamber for part of the meeting, but we'll try and get along if she can.
Okay, members aware of any other apologies?
No.
No. Okay, thank you. Okay, members, so moving on to the first item, which is a briefing from the Food Standards Agency on the Food Compositional Standards and Labelling Common Framework. I refer members to a copy of the FSA's opening statement at tab 2.1 of the pack, and to a copy of the Common Framework at tab 2.2 to 2.3. So I'd now like to welcome Miss Emily Miles, who's Chief Executive of the FSA, and Maria Jennings, who's Director here in the North. Members, we do, before I go to the panel, we do have a limited amount of time today, and so I'd ask members to make questions concise and responses as concise as possible, please, as well. So I'll go back to check, Emily, is it yourself or Maria? Maybe it's you, Maria, who's doing the briefing, is it?
I'll kick off. It's both of us. I won't read out the statement that we've sent you, but in summary, the framework puts in place a formal commitment that the four nations of the UK, so Northern Ireland, England, Wales and Scotland, will work together on food compositional standards and labelling policy development. And the framework provides the mechanisms for discussing joint ways of working. And we're very happy to expand on any points.
Okay. Okay, so are there any current changes being planned, Emily, that would come under this, or is this sort of future-proofing for what changes that may come around?
Thank you. Yeah, so there will from time to time be changes in food composition and standards rules. The ones that are being initiated at the moment by the EU relate to EU legislation on food information to consumers, which covers origin labelling and date marking, labelling of alcoholic beverages, front of pack nutrition labelling, and then, although this would be considered under the nutrition labelling framework, which is not this one, and setting of nutrient profiles. Doing our own bread and flour review at the moment. So we're looking, for instance, at how to remove ambiguity between fortification criteria and some overlapping rules on addition of vitamins and minerals. So that gives you a flavour. There is policy development that happens all the time. This framework is an approach by which the four nations of the UK can inform each other, collaborate, and ideally come to a joined up approach.
Okay, and how then does that actual process of negotiation take place? Is there like a committee in place, or how does that operate?
Yes, thank you. So it's set out in the framework itself. There is an official level committee on food composition standards and labelling, which is the main mechanism. And then and that committee, that the terms of reference are set out in the framework. It meets quarterly. It will be keeping an eye. So and each nation will need to bring things to that, and then there's a process of taking things through ministers, consulting, and so on.
Okay, and we did lose a bit of you there just after, keeping an eye on, but I'm not sure if that was just for myself, or I'll just check. Clerk, was Emily's sound interrupted for you as well?
Yes, there was a slight pause, so there was.
Okay.
Apologies for that. So let me say a little bit more. We have a food compositional standards and labelling officials group, which is a forum for all of the UK nations to look at proposed amendments to existing legislation or proposals for entirely new legislation. So that includes changes coming from the EU. And it's the forum where there would be a review of UK-wide impacts of proposed changes. And the intention for the forum is that we would get to a coordinated UK position on policy areas. Ministers, though, retain their right to make individual decisions for their governments So policy divergence is possible, but that would be worked through at official level. And there are some principles that group would be following. First of all, that the consumers would have the right to clear and accurate food information to make informed, healthy and safe choices, and that compliant businesses should be supported to trade across the UK with minimal barriers. So that's the intention of that group.
Okay. Okay, thank you. And then my final one from me then is maybe in relation to Maria's role, but what engagement has there been with the sector and locally? What engagement has there been to date, and how would engagement be taken forward to ensure that there's a very clear awareness of potential difficulties?
We've done quite a substantial amount of engagement, but I'll hand over to Maria to describe that.
Thanks, Emily.
Thanks, Emily, and thank you, Chair. Great question. We work with the food industry very closely in Northern Ireland. We tend to work through the industry representative bodies, but where we don't have representation for the food industry, we also work with individual businesses. And we've carried out a number of engagements with them on the framework, because it's very important for them to understand how these decisions will be taken on a 4-country basis. We also very recently sent them out a newsletter, which they were quite appreciative of, because some of this is quite complex, so we're able to describe it to them in written format, and then they come back to us and ask for questions. The industry is very supportive of the frameworks that we manage, because they can see that divergence will be minimised as much as possible. And that's the thing that they're worried about.
Would you mind if I just supplemented that a little? So we've done 2 tranches of engagement in October 2020 and then June 2021. In particular, there was an engagement event on the 17th of June 2021, to which there were 11 attendees from Northern Ireland. That included the UK Flour Millers, the Federation of Small Businesses, Moy Park, the Ulster Farmers Union, Seafish, Food NI, Asda, Henderson's Group, Food and Drink Ireland, Caro Foods and PRM Group. And we've consulted a broader number of stakeholders in Northern Ireland as well. Okay, and then, so I'm very conscious, and I do have a lot of very significant food manufacturers in my own constituency. And I am, partially as a result of that, but I am aware of the very intricate nature of food production back and forward across the border. So how then does that connection, or how do you sort of pick up on what may create difficulties for food manufacturing within the supply chain here on an ongoing basis, north-south even? Apologies. The FSA has got 2 main fora where we work across Ireland. First of all, we have a memorandum of understanding with the Food Safety Authority of Ireland, and Maria can say a little bit more about how we work closely with them. And secondly, we work with the All Ireland Body Safe Food. Maria, do you want to pick up a bit more on that?
Yes, very happy to. And at the moment, you have to remember that the EU rules apply equally across the 2 jurisdictions. So the rules are exactly the same for food businesses on the island of Ireland. But we have a very deep and ongoing working relationship with the Food Safety Authority of Ireland. We've done a number of things with them over the years. So, for example, we share intelligence, we gather scientific evidence as well across the island. Our food incidents teams meet on a weekly basis to make sure that we're dealing with food incidents across the jurisdictions. So we have an ongoing conversation with the Food Safety Authority, both at working level and also more strategically at senior level. And we do talk to them about the frameworks, because that team is very interested in how we will make decisions across the UK as well. So we've described all of that to the team in the Food Safety Authority. Okay, so thank you. That's about all from me. I don't see any indications from members there, but I'm going to check with the clerk if there are any questions from members indicated to you, Keith.
No indications from members, Chair.
Okay, well listen, Emily and Maria, thank you once again for coming to committee, and I guess this will probably be the last time for this particular committee, but I want to thank you for your assistance to committee during the course of our mandate, and to wish you all the best in the time ahead, and we can go ahead and have a look now at the framework itself. Thank you.
Okay. Thank you very much.
Okay, members. So, members, I just think, given this will fall more to an incoming committee, I think it's probably most appropriate that we simply note the framework if members are content. Yeah. Members content. Okay. Yeah. Thank you, members. Yeah. Thanks. Okay, members. Moving on then to committee legacy report, and refer you to the draft report at tab 3.1 of the table papers. I would ask the clerk to take members through the report, please. So go ahead, Clerk.
Thanks, Chair. The legacy report is in your table pack. That was issued out yesterday, so you should have it in front of you. So the legacy report essentially is as I discussed last week, there's a template, and we fill out essentially a look back over the committee's work. So if you look at page 8 of your table pack is essentially where the most of the report starts from. So it outlines the review of the 2017 to 22 mandate with a key summary of scrutiny. So during that period, the committee did undertake the care home inquiry. So again, there's a wee bit of information about the care home inquiry. Then we go into policy scrutiny, and I've put a few headlines in. So one, COVID-19, outlining committee's consideration of that issue. Then there's the transformation and post-pandemic rebuilding of services. Within that, I've mentioned Encompass. I've also mentioned committee outlining the importance of having an all-island approach to healthcare where possible. Highlighting there's some good examples of an all-island approach. And then just a bit more around the transformation agenda. We have a section on waiting lists and elective care. We have another section on workforce. We have a section on neurology services. And then we also have a section on mental health and substance abuse. Information on committee's work on inquiry into hyponatremia related deaths. And a wee bit of information on dental services and what the committee's done. So I've tried to include a few other areas within those. And again, this, to be honest, if we were to write a full summary of what the committee's done, it would at least be a couple of hundred pages. But we've tried to keep it as concise as possible. We then go into a section that outlines the legislative consent memorandums the committee's considered. So it lists the 8 that the committee have considered in the last couple of years. Then further information on statutory rules and what statutory rules the committee have had. Now, there's a bit more information on the number of statutory rules the committee's considered. I think I worked out it was near enough 250 over the last 2 years, whereas normally for health, you're probably looking somewhere between 20 and 30 a year. So there's been a significant piece of work done on statutory rules. There's a section then on primary legislation. So we've listed the 7 bills that we've considered with a wee bit of a summary on each of them and what the committee did in each of them. And then we go into, from page 21 of the table pack, into the committee's approach. So again, I've highlighted that the committee's focus has been on engagement with organisations, with stakeholders, that was central to the committee's approach to taking evidence and considering issues. Outlined the committee continued to meet during periods of recess throughout the last couple of years, and that's seen through the number of formal committee meetings. I think probably after Thursday, including concurrent meetings, will not be far off 120 meetings. Formal meetings, that is. I also had a look, and again, we had a number of informal meetings. Certainly in my time, which is just over 13, 14 months, I think we're close to 35 informal meetings in that period as well. And again, I've just outlined some of the key informal meetings we had with the mother and baby homes representatives around Mental Health Awareness Week, Organ Tissue Donation Bill, Adoption and Children Bill. We met with a number of the Royal Colleges, and the Chair and Deputy Chair also met with a number of organisations over that period as well. There's a section in relation to visits, external meetings and events. Obviously, with the pandemic, we haven't maybe done as much as what we would normally do, but we've outlined the meeting held in Dungannon. We've outlined the meeting with the Disabled People's Parliament, and then we also outlined the Seem to Be Heard event that was last week as well. So I suppose the main part is suggested issues for Successor Committee. So from page 25 onwards, issue 1 is COVID, and I suppose the focus on this is application of lessons learned for future planning. The transformation, the workforce issue, which we've mentioned, rollout of MDTs, retention recruitment, importance of that, and the importance of trying to lower the agency spend. Issue 4 then is neurology, and just to keep an eye on the 3 issues: the inquiry report, the RQIA reviewing the deceased patients, and then the department on the recall of patients. Issue 5 then is mental health and substance abuse strategies, including looking at the waiting lists for CAMS. Issue 6 is the cancer strategy and how it's implemented. I think I might have got something through today that it's going to be released this week. So it is. So it'll be something that will need to be considered. Budget, and again, focus on trying to make the budget as transparent as possible. Members have said all along throughout this mandate that it's very difficult to follow allocations. So it is. So there's a big allocation given in a monitoring round, and it's difficult to see that actually filter through to the service provided on the ground. So I think there could be some work done on it. And then the last one is review of legislation. So again, we've mentioned there specifically the Autism Amendment Bill and the Adoption and Children Bill as two that we'd be keen to see how they're implemented. There then is a section of facts and figures outlining total number of meetings. So that's page 29. They're on page 31, then there's further information, statutory rules, and the number that we've considered. And then I suppose the interesting figures are in relation to the section on witnesses. Over the two and a bit years, the total number of organisations who give evidence to the committee is well over 1,000 in that period. So that's 1,000 different sessions the committee's held with organisations and witnesses. So, you know, when we've taken evidence where we maybe heard from 3 or 4 organisations at once, when we've heard from the department on a number of issues, it does show the committee's intention was to engage, and I think this proves that the committee has done considerable engagement. I would note that 21-22 figure is essentially from the start of this session, which would be September. So that's September through to now, so it's a period of 7 months. The final section is a table on expenditure by the committee. And I would just outline the big cost there around advertising. That's the cost of putting adverts in the paper on the committee's consultations on the bills. So we had 7 bills, and it's pretty much £500-600 to get those advertised. Then under general expenses, you'll see there's a couple of figures. There's one of those figures that's related to the cost of extra meetings. So you'll be aware that we did meet a number of times over recess. There was additional cost to those meetings, because it was outside the normal contract. So that's where there's a large proportion of general expenses is taken up with extra meetings. So I'll try and make that a bit clearer in the final report, to outline that there was a considerable cost in relation to additional meetings. And hopefully that's a very quick run through the legacy report. It'll be published following agreement on Thursday, and I'd be keen that if members have any other issues that they want to highlight, either under the issues for the next committee, or if they want me to put any more commentary in with some of the other issues, I'd be happy to do that.
Okay, thank you, Keith. And I hope members will get maybe more of an opportunity to reflect on the report on Thursday. Today, I suppose we should just focus on getting it tidied up in a sense. But I just want to acknowledge very briefly the phenomenal amount of work for members and most particularly for committee staff in doing all of that, what you're after reporting on there, Keith, including changing things around to facilitate meetings. It's been really phenomenal, and I think you're right. We not only talked the talk around engagement, I think we demonstrated it in terms of how we conducted our own business, and it shows very clearly now when you sum it all up. A couple of wee things I just want to reflect on, just sort of by way of things that I think should be, and a couple of, first of all, a note, I think there's 2 6s there, just typo-wise in the issues. There's a Chancellor's labelled as 6 in budget. Yeah. The other thing is, I think on workforce, I think we need to include safe staffing legislation as a comment within workforce. And in relation to transformation, we had talked last week about the issue of having a focus on where we can do things better on an all-island basis. That needs to be included within the transformation section, I think. But otherwise, I think it's a really good piece of work. It probably does underplay the amount of work, but it does capture very well the amount of product that the committee has generated over a difficult period of time. The SRs kind of highlight that as much as anything. Like, those were additional and difficult pieces of work on top of all the other legislation. And it is worth noting, no other committee has ever had to deal with as much legislation. So that's all noteworthy. So, Pam, you were looking in there?
Yes, thanks, Chair. I just wanted to say thank you to Keith, the clerk, and the team for the work that they've put even into this report. And it is very clear that there's been an unprecedented amount of legislation and work that has gone on within this committee, and it's actually been a pleasure to be a part of it. And I think probably, Chair, like myself, you're probably feeling a bit tired at this point because it has been an incredible workload, but we do really appreciate the effort that the staff in particular have put in. And when we're glibly saying things like we met during recess, that meant that all the staff had to come in and didn't maybe get their holidays. So we know even staff are owed an awful lot of holidays because they haven't had them. So just to put on record our appreciation for that. And I wanted to mention the fact that I do welcome the review, in particular of the autism bill, given that the bill came on the back of the fact that the original Autism Act was not implemented, and certainly not implemented in the way it was meant to be implemented. So I think that's really important going forward. And that's all my comments for now. Thank you.
Thanks, Pam. And anybody else on anything that they think is noticeably missing or anything that they wanted to raise? Carol?
Yeah, again, just to repeat everybody's comments to Keith and all the staff in relation to, it's been full on, to be honest. It's probably one of the most busiest committees I've ever been on, and I'm here from 2007. So just to say that, you've covered the issue in relation to safe staffing legislation, Chair. So, and the other thing I think is missing, we did raise the issue of all-island pathology services for paediatrics, because it's something that is unresolved, to be honest. So I'd like to see something like that in, Chair, but thank you.
Okay, thank you, Carol. So members, there also is the facility there by 12 o'clock tomorrow. If there's anything else that members want to include or draw to the clerk's attention, the clerk is asking that by 12 noon tomorrow, those are with him, so we can have the final report on Thursday, and we can then hopefully use that as an opportunity to reflect as well. So I appreciate that. Okay, thank you, members. Moving on then to the first of our SRs, which is SR 2022/100, the Recovery of Health Service Charges Amounts Amendment Regulations NI 2022. So members, this SR will apply an inflationary uplift to the current tariff levels of the scheme that provides for the collection of the costs incurred by hospitals in treating the casualties of road accidents. The committee considered the SL1 on the 10th of March and agreed it was content that the department makes the SR. The examiner of statutory rules has no issues to raise in relation to the SR, which is subject to negative resolution. So do members have any further issues they wish to raise in connection with that rule? No, thank you. If not, then can I ask members to agree formally that the Committee for Health has considered SR 2022/100, Recovery of Health Service Charges Amounts Amendment Regulations 2022, and has no objection to the rule? Are we agreed? Agreed. Thank you, members. The next one then, members, is SR 2022/104, and I refer members to papers at tab 5 of your pack. This SR amends regulations pertaining to dental and ophthalmic primary care provision for the North, consequential to the closure of the Regional Health and Social Care Board. Members will recall that the committee has already considered SL1 for this SR and agreed that we were content that the department makes the SR. I can advise members that the Examiner of Statutory Rules has not yet reported on this SR, which is subject to negative resolution. Do members have any further issues they wish to raise in connection with the statutory rule? No. If not, then can I ask members to agree that the Committee for Health has considered SR 2022/104, the Health and Social Care Act NI 2022, General Dental and Ophthalmic Services, Consequential and Miscellaneous Amendment Regulations NI 2022, and, subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Yep, thank you, members. Moving on to SR 2022/106, and this is the Regulation and Improvement Authority Fees and Frequency of Inspections Amendment Regulations. I refer members to the papers at tab 6 of your pack. The committee considered the SL1 for this SR at its meeting on the 10th of March and agreed that it was content the department makes the SR. The committee did request further information on what engagement there's been with service users and patients, and if there were any significant safety issues or risks identified by reducing the frequency of inspections. The department's response is at tab 6.4. I can advise members that the Examiner of Statutory Rules has not yet reported on this SR, which is subject to negative resolution. So I just want to check before I go to members to see if there's any issues. Was there some outstanding information, Clerk, on this, or was the information all contained within tab 6.4?
There was some information in relation to engagement with the sector and organisations, and there was some information around public consultation workshops. So, Chair, it looks as though a majority of the issues have been addressed in that response at 6.4.
Okay, do members have any further issues they wish to raise in connection with the rule? No, thank you, members. So therefore, can I ask members to agree formally that the Committee for Health has considered SR 2022/106, Regulation and Improvement Authority, Fees and Frequency of Inspections Amendment Regulations, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Yep, thank you, members. Moving on again, members, to SR 2022/116. I refer members to papers at tab 7 of your pack. This SR amends and omits references to the Health and Social Care Board within the Pharmaceutical regulations. The committee considered the SL1 for this SR at our meeting on the 10th of March and agreed that we were content that the department makes the SR. I can advise members that the Examiner of Statutory Rules has not yet reported on this SR, which is subject to negative resolution. Have members any further issues they wish to raise in connection with this statutory rule? No, thank you, members. Can I then ask members to agree formally that the Committee for Health has considered SR 2022/116, the Pharmaceutical Services Amendment Number 2, Regulations NI 2022, and subject to the report of the Examiner of Statutory Rules, has no objection to the rule. Are we agreed? Agreed. Thank you, members. Members, moving on then, a few SL1s just to deal with today. First of all is SL1 on Firefighters Pension Scheme Amendment Regulations 2022. I refer members to papers at tab 8 of the pack. The Department advises that this proposed SR will amend the firefighters' pension schemes and implement the first stage of what is known as the McLeod remedy. So I think that is essentially where a court case has led to improvements for staff. So do members have any issues that they wish to raise in relation to that rule, or are members content that we note? And I think it's more appropriate to note at this stage, given it will become an SR for an incoming committee. So would members wish to raise any issues or content, any issues to raise?
No, just content to note, Chair.
Content to note. All committee members content to note. Yeah, thank you. Item 9 then is another SL1, Health and Social Care Pension Schemes Amendment Regulations NI 2022. I refer members to the papers at tab 9 of your pack. The Department advises that this proposed SR will ensure equal treatment for all HSC pension scheme members by moving all members into the 2015 HSC pension scheme on the 1st of April 2022, irrespective of age. This is the first stage of what is known also as part of the McLeod remedy, and I will just at that point declare my own interest in relation to being on a career break with one of the health and social care trusts. Do members have any issues to raise? No. Are members therefore content to note the SL1? Yeah, thank you. SL1 Children's Social Care Consequential Amendments Regulations NI 2022. I refer members to the papers at tab 10 of the pack. The Department advises that this proposed SR contains the amendments considered necessary to support the transfer of functions under the Adoption Order and Children Order to HSC trusts, and to ensure necessary representation on the Safeguarding Board for the North following the dissolution of the Regional Board. Any issues to raise, members? And members content to note the SL1? Yeah, thank you, members. Okay, members, that just takes me on to date, time and place of next meeting, and I appreciate all of you for squeezing in today's meeting and considering these items. But our next meeting will be on Thursday, 24th of March at 9:30 a.m. and I look forward to seeing you all there. All the best, members. Biggie slam.